Dear viewers, welcome to our today's format visit. I have received some letters, which is quite strange, asking me to talk about a topic which concerns the gynecological area, namely the dryness of the vagina. This is a problem which is observed by about 70 to 80% of women during menopause. And with a painful feeling of soreness in the vagina, with a very strong feeling of dryness, which often rises, sometimes also irritates the bladder, a so-called stimulant bladder is present. The interaction between the bladder, the urination, the irritable bladder in the sense of a stress incontinence bladder, then again the focus, maybe it is a chronic bladder inflammation, cystitis, and these are things which are very, very unpleasant. Of course, it is important to look at how far the urine itself is already burdened by bacteria. But let's go back to what actually makes the female genitalia so powerful when it is young. And that is the equipment with a sufficient hormonal cocktail. We women also have estrogen, like men, we have testosterone, like men, we also have progesterone. And this estrogen itself is not just the estrogen, but it is actually our great supply hormone, we call it. That means, this estrogen is actually in a very high and strong production when we are young, when we are now entering puberty, and then, above all, when we women are sexually mature, then to think of the next generation. This estrogen itself is a hormone, I would say, which is also the hormone of femininity, the hormone of our curves. If we have too much estrogen, then the problem areas are particularly burdened, so the belly, the pelvis, and the thighs. The estrogen is responsible for having a firm skin, for looking beautiful. If estrogen is a weak device, then we are irritated, then we are no longer balanced. Estrogen has a great influence on our good mental health, and it is actually proportionally the strongest female hormone. There is a subgroup, that is the estradiol, which is formed in the ovaries. The estrone, especially in the postmenopause, and it is then enriched in the fat tissue. But the estrol, which is also part of the estrogen, is mainly responsible for the vagina and for the good passenger possibility in the sexual intercourse. It makes a moist mucous membrane and ensures that we always have a good, milky, acidic mucous membrane environment there. That is so important, and we can actually rely on it for many, many years, that these three play well together. But with menopause, when the period is over, the task to ensure the next generation is also over. And that is also good. But of course, This also significantly reduces the provision of all these vital estrogens. And we have to be aware that, for example, estrogen is formed by DHEA, dihydrogestrel. And this DHEA is formed by the adenomas next to the ovaries. That means a woman who has a lot of stress first sacrifices this DHEA and can thus form less estrogen and testosterone. Estrogen is also responsible for our ligament tissue, for our collagen fibers, for the strength of our muscles, and for the emotional need I have already reported. That is estrogen. The other is testosterone. Testosterone also gives us women enough mental vitality, just like men. We just don't have it as strongly as men percentually to estrogen. It is responsible for a libido, it is responsible for the muscle structure, and it is responsible for the power, for the spiritual, for the clear power, for our spiritual creative power. And then there is of course progesterone, which is the counterplayer to estrogen. Progesterone deficiency always creates a latent estrogen surplus. Don't underestimate that. Estrogen can be a too much, not because it is too much, but because a progesterone is too low. This progesterone is very important because it seems to be dehydrating. Women who store eggs and where the legs become heavy or the hands swell or the eyelids, that is often a progesterone deficiency. And what is very important, progesterone is important for our brain health. We cannot sleep well with a progesterone deficiency. That is why it is very important that you sometimes, I like to examine the hormones in the saliva, but that you also do a status. What is the relationship between estrogen and progesterone? Women who still have their period, please let them take this saliva sample before the period. This can be about 3 to 7 to 10 days before the period. Then progesterone increases, and as progesterone replacement bleeding, the period begins. But for women who no longer have the period, then at any time. But the look at it is so valuable because we need everything. But we no longer need everything in the same dosage, but the body regulates itself well below. But if it then of course comes to the fact that we no longer meet the need for these hormones, then we have to make sure that the hormone activity is stimulated. And what is very nice, especially the whole neuroendocrine stress axis, can be incredibly activated by a ritual of the 5 Tibetans, even if we are in menopause. The 5 Tibetans are celebrated up to 21 times per exercise in the morning. The other thing is movement. We are not talking about movement at all. I don't want to think about hormone replacement right away, but first of all, how do I activate hormones? And I do that when I signal to the body that I want to stay in my vitality. And for this muscle structure, it must of course also produce testosterone, because it is needed. If I don't need my muscles, why do I need enough testosterone? The body always balances everything that you expect from it in life. And the other thing is that we today, this symptomatology that we perceive with a very strong dryness of the vagina, also essentially attribute to another fact, and that is vaginal atrophy. That means that the vaginal mucous membrane itself becomes thinner, atrophied. It becomes really, I don't want to say wrinkly, but it is no longer so powerful, so built up, so heavily circulated, so good also in the secretion, but it becomes pretty transparent. Gynecologists can actually determine this very quickly, and it burns sometimes, it itches sometimes. That's why sometimes the thought comes, maybe I still have a fungus infection here. But you usually don't get fungi, but fungus growth develops in warmth and moisture. And that's not all, quite the opposite. If this milky acid film, the vagina has a very deep pH value. Then the so-called milky acid bacteria, also called dodeline flora, can feel at home and produce this milky acid mucus, supported by the hormone estrone. And this deficiency of this hormone is of course also due to the fact that this mucous membrane is dry, that it burns, that it becomes sensitive when urine comes against it, and that you always have this discomfort. That's why it actually means that you have to be very careful about this process. And the precaution, and I'm already getting a little bit to the therapeutic part, is that you use a lot of water. Just wash with water, rinse off with warm water, and then don't go with scent and perfumed things. Because if you do, then there's the Vagisane, which is a very nice milky acid fermented soap, which is created for this pH value of the vagina. Not too much, maybe every evening or once or twice at most. But make sure you have a good, clear balance and don't necessarily interfere with this process with perfumes in any form. The other thing is that I would say, a membrane flora is re-established, if, of course, these dodeline microorganisms, lactobacillus, bifidus bacteria, can settle in again. And I can do that very well with lactic acid. Lactic acid is contained, for example, in the Vagisane suppositories. But there are also other lactic acid suppositories. I would recommend doing this in the evening when you go to bed, because by dissolving, of course, it only runs in one direction. But you can build up this environment wonderfully well with it. It's not everything, but it's very valuable that you also fabricate these things until you notice, in connection, of course, with others, now the process has reached a new stability again. And that's not all, but at the beginning I would insert a suppository every evening. The other thing is that we have a so-called estriol cream. This is a natural estriol cream. And I would ask you to apply it well once a week in the morning and evening, so that such a mucous membrane can also settle in again and the information of this degradation can regenerate into a build-up. This estriol can then also be inserted deeper with a dispenser. You can also very gladly do it with your finger. But don't just use it outside, but go a little further and maybe do it for a week, twice a day, and then maybe only once a day for 3 weeks. Could be good enough, depending on what stage you are in now. And if you only do this estriol 3 times a week later, then use the Jeepin the other days. That's a little pump spray and it makes a gel. This gel is actually very interesting, because on the one hand it contains mannose. So a lot of women who still have a bladder inflammation. If you always examine urine, you will find Escherichia coli, for example. And from the back of the perineum, from the anus, and the excretion of coli can very quickly penetrate into the vagina, of course. That's why you always wash from front to back and rinse off and never move from back to front. And this Gepan is a gel that contains mannose. And mannose prevents Escherichia coli from sticking to the mucous membrane. It's a good preparation for a bladder inflammation, if it's in there. But in this gel, it's in there to balance the connection of Escherichia coli and the mucous membrane of the vagina. So that there is no adjustment possible. And it also contains hyaluronic acid, which is of course very important for the structure of the mucous membrane. It may be that it burns a little at first, but you can actually take it quite well for general care. Morning and evening or once a day. And this estriol salve, then initially more intense, but then only 3 times or maybe twice a week, depending on the adjustment. For women who still have a positive PAP, that means a cervix, cell dysplasia it's called, or who have a very low value of vitamin D, which is the big regeneration hormone, there are various pharmacies that also produce vitamin D as an ovular or as a suppository. This has also proven to be good, to use vitamin D suppository that can then be inserted. Whenever you have an inflammation of the bladder, I came across a very interesting preparation, that is called UT-Pro Plus. UT-Pro Plus. That's why it's so interesting, because it has a gel protection function. Bladder, vagina, that's all very close together, of course. And it's about mucous membranes. Estrone is responsible for the mucous membranes. And those have an influence not only on the bladder or the capsules. The capsules, I'm sorry, I'm already on the capsules, have not only an influence on the bladder, but also on the intestine. And the mannose that's in there does exactly the same. It prevents the coli bacteria from now on to stick to the mucous membranes. That's very interesting. On the other hand, there is also hyaluronic acid in the gel. On the other hand, this preparation contains the gel protection through hibiscus and propolis. That's very interesting. So both highly anti-inflammatory plants, which have proven themselves here with a recurring cystitis, which is often caused by atrophy of the mucous membrane. And this also affects the bladder mucous membrane in combination with the gel, with the mannose in success. You take the capsules there, at the beginning, so twice one and then go down to 1 capsule. Until the whole system has stabilized well, and then later on, you can maybe, if that was a process that was going on for many weeks and months, that always somehow maneuvered there, you can just take 1 capsule for 15 days a month. Then you give the whole system peace and then another 15 days. Take care of that a little bit. You have your own clinic, your own symptoms. And then of course you can feel how far this UT-Pro Plus through the tamara bark tree also makes such a gel protection. So the gel protection on one hand, through this Gepan, which is connected to mannose, and on the other through these capsules. I have now discovered this for myself as an advice from a dear gynecologist, and I think the combination is really nice. Yes, and a lot when you talk about bladders, women often have cold feet. Many women say it's usually too cold for me. Make a 6-week tea cure with Wacholder. Wacholder is the big warming plant. 2 or 3 grams of these Wacholder berries are enough. The berries are dried, they are crushed, put in a sieve, and then brewed with hot water. Just leave it for 5 to 10 minutes and the Wacholder starts to do a big warm-up. It has proven itself incredibly effective against recurring urethral infections, irritable bowel syndrome, and gastrointestinal complaints. Everything falls and stands with good circulation. And now we have autumn, now comes winter. That means we should always make sure that everything is wrapped up warmly. If you get cold feet, the bladder will be circulated less and is more susceptible to inflammation. I'm a little bit off the topic of vaginal atrophy now, but I think these are very important things now, because humans have a body temperature of 36.8 to 37.2. That's his operating temperature. We really have to be careful and support temperature regulation. You can do that wonderfully with the Wacholder tea, or in the evening with good foot warming baths. Just put a spoonful of Himalayan salt in there or sea salt. But make sure that this whole area is always comfortable and warm through the winter. I would like to appeal to our many young patients or viewers. Don't be so unthoughtful. In this sense, I think we have addressed a topic that should be addressed. I know that this is a big topic for a lot of people, but there is a lot of ways to get help. In this sense, I look forward to your entries at Visite at QS24 TV and, above all, to the next program. All the best to you.